session on what it will take to reach the end of extreme poverty. And I am incredibly honored that we are joined by two global leaders and practical visionaries who have played such a big part in driving that goal and also tackling so many of the diseases and conditions that are both causes and consequences of poverty. And it was rather a dream come true for me to bring all of you together with these two leaders for whom I have such great respect, and again, who play such a critical role in what it will take to get to the last mile in ending extreme poverty. And both of these leaders have, through innovation and dogged commitment, done things that people said were too hard or even impossible. Sir Fazle, Abed, and BRAC have shown that it is possible to reach the ultra-poor and have a transformational impact on their lives and to take programs to scale. Dr. Kim has helped drive the world in setting bold targets on HIV and on ending extreme poverty, and also fought for reaching patients the world gave up on. So I want to say just a few words about each of them, and then we're going to have a bit of a dialogue with some questions from me for each of them, and then I hope a dialogue between them as the conversation spins out. And then I will note that Dr. Kim was very generous in joining us now. He's going to have to leave right at 9:30 sharp because he has to get on a plane to go to Indonesia. And even so, I think he's going to be running really late. And then Sir Fazle Abed will stay with us for a bit to have more of a dialogue as well with the audience. So I don't want to give a long bio. You have their bios. Dr. Jim Kim is the 12th president of the World Bank Group, now in his second term. He's a physician, he's an anthropologist. He's dedicated his life to improve the lives of underserved populations around the world. And I've had the privilege of working with him for almost 2 decades now. And I think the things that I would want to just note quickly is the work that he did early on to make tuberculosis and drug-resistant tuberculosis a priority for the world when people said those patients couldn't and didn't need to get treated. His leadership in launching 3x5, the initiative that in many ways moved the world forward in taking ambitious action on HIV treatment. And then most recently, even in advance of the Sustainable Development Goals, launching through the World Bank Group the goal of ending extreme poverty and boosting shared prosperity, and his most recent extreme enthusiasm and active engagement around the issue of ending stunting, and we'll come back to that. And then Sir Fazle Abed is an incredible honor to have him here. He tells the story of how he was working before the liberation war in Bangladesh, and the cyclone and the impact in the country dramatically changed his life and the course of his life, and how he came back to Bangladesh and formed BRAC, which is now the largest, and many would argue the most effective non-governmental organization in the world. Again, first formed to meet the needs of refugees, but now doing remarkable work not only in Bangladesh, but in some dozen countries and more around the world, and with replications of its work in dozens more countries. He's been honored with numerous awards and international recognition. For me, the most remarkable thing about BRAC is the breadth and comprehensiveness of the work they do, their commitment and ability to taking programs to scale, and their commitment to reaching and testing their own capacity to reach the ultra-poor. And just to say, I've had the wonderful opportunity of bringing congressional delegations to see BRAC's programs on the ground, including people like Senator Durbin, and to meet Sir Fazle. And that's been a great honor. So those, if the audience, if you guys want to take a more formal opportunity to just welcome our guests, and then we'll jump into the questions. So, Sir Fazle.
But Joe, let me say, as you know, I come here every year because you guys are the easiest audience I faced in the whole year. I've never had a standing ovation before I spoke.
It is a reflection of everybody's commitment and enthusiasm about getting this job done. So, So if I can start with you, Sir Fazle, you know, both of you have stated that ending extreme poverty is going to require a proactive approach to reaching people living in the most extreme poverty,
Yes, yes.
and to achieve real equity, you know, not in a theoretical way, is going to really require that kind of targeting. So if you could maybe just start out and tell us a bit about BRAC's ultra poor programs, why this approach is important and unique, comprehensive, and how it's transforming the lives of people in extreme poverty.
Well, thank you, Joanne. I think I've been one of the greatest admirers of results. Its work early on in 1980s when results supported immunization program, child survival program throughout the world, and we got lots of benefit from that your work on that. Then your advocacy for tuberculosis control, that also we have benefited a lot from getting funding from the Global Fund. So thank you, Results, and thank you, the volunteers and staff of Results, for doing such a wonderful work in promoting global equity, as well as now, of course, you'll be working on the SDG agenda. Hopefully, the first agenda, of course, is getting the world rid of all forms of poverty. And we have been working at it now. I remember in 1995, we thought that we have covered everybody with microfinance, and microfinance is having a great impact on poverty. But we found that a survey was done in Bangladesh, and we found that 10% of the poorest Bangladeshis didn't have access to microfinance. So we wanted to find out why is this, because our microfinance was focused on poor people. But then we found that the poorest are excluded. First of all, they themselves didn't believe that they can use financial services profitably. Secondly, they won't be able to repay the money. And then thirdly, there was the group within the village who were poor enough, but they thought that these were too poor to be able to repay loan. So they kept them out. So as a result, so these people are out. So we then thought that maybe these people, the poorest of the poor, and these are ultra poor, we define as those who are living less than half the poverty threshold, which is $190 a day right now. So if it is below $90, 90 cents a day, these are the ultra poor people. And they are trapped in a sense that they can't get out of poverty with the kind of program we have, government programs or other programs by financial organization, microfinance organization, NGOs, and so on. So we needed to design a special kind of program to get them out of poverty. And that program was designed firstly to identify the poorest in the village. So we involved the village itself, all the villages, try and rank households in terms of wealth ranking. So poorest 10%, the poorest in the village, 10% of the village, they identified for us. It was an open session in which people decided who were the poorest. So identification of the poorest was the first one, and then of course our workers went to these households to find out whether they were in fact the poorest, and they found that they were so. And then we took them in. So identification or the right people. Secondly, we provided them not a loan but a grant, a investment. We called it transfer of assets. So it could be a cow, could be half a dozen goats, and so on. So it's something which could give them an earning. Thirdly, we provided them a stipend, so that as long as their income earning source was not earning anything, they could still, meet their needs. Fourthly, we provided them training and hand-holding, coaching, and getting them to save money, savings habit. And so that went on for 2 years while we provided all this support to them, and we took their children to school. We didn't want the children to remain, to reproduce poverty again. So these are the combination of interventions that BRAC gave to each family. And each family, it cost us approximately $500 per family. So it was, so after 2 years, they were on their own. So it was a program which was designed for 2 years, and after that, they were supposed to get out of poverty gradually over time. So we called it graduation. We graduated them, and then so this program was seen by the CGAP, the World Bank's affiliate organization, the consultative group of assisting the poor, and they and the Ford Foundation then replicated this program in 10 countries, or 8 countries and 10 programs. And the results of this program has now come out in a number of different studies done by MIT as well as the Yale University, and they published in Science magazine in 2015. And they showed that each of the program so this Science magazine report was a randomized controlled trial, reported that they did on 6 country studies, reported that all the countries, the program had a positive return on investment. Some countries it has done better, some countries had not, but particularly India, Pakistan, Ethiopia, Ghana did very well, but Honduras and Peru didn't do so well, but even then they were positive. So there were quite a lot of debate then started that what is the most effective anti-poverty program. So it was one of those things that I think Nicholas Kristof came out with an article in New York Times saying that it is the power of hope. So obviously poor women, heads of households, hopeless, have always suffered from lack of resources, suddenly getting a big push in terms of resources, in terms of help, in terms of training, in terms of getting their children to school, suddenly see that their life could be changed by their own work. So they start actually working more, and over time, they even come out of poverty. So a study was done by the London School of Economics in the BRAC program, where we have now graduated 1.7 million families, and the London School of Economics program showed that even after 7 years after the family have left BRAC program, they still continue to improve their condition compared to their control group. So they have continued to improve themselves rather than staying steady at poor stage. So there seems to be some change that happens to people which sort of propels them to work hard and improve themselves. So that's the graduation program in short that we have been doing. And right now there are, I think, 20-30 countries they are doing this program in small scale, and about another 1 million families are probably involved also in the graduation program. So 1.7 million by BRAC, and probably another 1 million by others who are now trying out this program in various countries in a smaller scale. But so what we would like to do is it is not the only answer to the problems of poverty in the world. This is one of the ways in which we can tackle extreme poverty in families, particularly who feel trapped in poverty. So that's what we are trying to do.
It's really remarkable, and having seen it, you see the individual transformation and hope as well as...
Right.
And the 2 things I would just say very quickly. One is, I think the exciting next opportunity that makes these programs have such even greater potential is the ability to layer on existing social protection programs to go to scale, which seems very exciting. And also that though brand new, that there'll be a new platform on economic inclusion within the jobs group at the bank to help take some of these things forward. So I think it's really exciting. So, Jim, I'd say any comments you want to make related to this? Other comments around just on where we are and the goal of ending extreme poverty, but on a sort of related topic, you've been doing so much work with the bank and with your own advocacy around supporting governments, heads of state, ministers of finance, and governments to increase investment in human capital as a part of this, including people living in extreme poverty. So anything you would want to say on that? And I think this also relates so powerfully to the whole issue of stunting that you have been sort of the global champion on, and why that matters so much, both for the extreme people living in extreme poverty, but also for breaking the intergenerational cycle. So anything you want to say there?
Well, thanks, Joanne. And let me also start by saluting all of you here at Results. Joanne was my tutor. Now, gosh, it was close to 20 years ago. She took me to see Sherrod Brown, and it's the first time I ever met a member of the U.S. Congress. And we were supposed to have a 15-minute meeting. It turned into about an hour and a half. And at the end of the meeting, Sherrod asked me, so what can I do for you? And I didn't even know that you're supposed to go in with an ask. You guys all, you guys all know this. And so I just, out of the top of my head, I said, why don't you go with me to Russia to look at tuberculosis in the prison system? And he did. And we went. And Joanne came too. And it was just an incredible experience that started a relationship. But it also, Joanne is just, I think, the greatest advocate on the face of the earth. And someday we'll be able to count the number of lives that she's been able to save. But it's just such an honor for me to be here with Sir Abed. If you just listen, and I took notes from what he said. If you just listen to what he said, this is a man who really has understood what human societies are for, and long before anyone else understood that having a bank and using finance for the good of the poorest of the poor, this is not a bad thing. It's actually the one thing that might help us to end extreme poverty. So just let's just go through what he said. First of all, they started with grants. Right? Totally against ideology. You don't give poor people money just in the form of grants. Next thing, they gave them a stipend. No, you don't give poor people a stipend, because then it'll increase your wage bill and it'll make them dependent, on and on and on. Everything he did, the training, coaching, handle, focus on savings, right? This is all this is all stuff that might have been done, but doing those things in the absence of grants and stipends, would have been literally, I think, blaming the poor for their poverty, which is what we've done for a long, long time. So this is a person who went against the tide, and rather than focusing on the aggrandizement of BRAC, I mean, that's one of the great tragedies is that not enough people in the world know about BRAC. Instead of focusing on that, which so many leaders of organizations like this do, I mean, it's all about them, they've just focused on working against ideology, making sure that the results are really there, as the results like you guys, and then quietly presenting this to the world. So I think the most important thing now is to change the way heads of state and ministers of finance think about investing in their own people. Because right now, unfortunately, there's no cost to not investing in your own people. And I think we have to create overwhelming demand for BRAC programs in every poor country in the world. I mean, BRAC has figured it out to an extent that I think nobody else has in terms of getting to the extreme poor and then taking them through all the stages that are necessary to lift them out of poverty, have them, give them a job, create new possibilities for their children. So one of the things that I'm working, in addition to, we made a $15 billion commitment to health in Africa. We did all the usual things. We're working on stunting. But the thing that struck me is that, in all the years that I hadn't met a single minister of finance, I kept thinking, if we could just get in front of the ministers of finance, we can change their minds and they'll invest in health. Well, I'm in front of the ministers of finance literally every day. And I tell you, me telling them that health is important has not really changed their commitment to health and education. It hasn't. So we're working on now something that we're playing around with. Human capital sounds so so impersonal. So maybe human capacity or something like that. But there is no question that better health outcomes, better educational outcomes, and the existence of social protection programs are directly related to economic growth, short, medium, and long term. But we've never formalized that. We've never done it in a way that every year a head of state and minister of finance has to read the front page of their newspaper to find out where they stand in the world on investing in their own people. So we're working with Chris Murray out of the University of Washington and the Gates Foundation, and we're going to try to put together something we're calling either a human capacity or human capital index, so that every country will know where they sit. And to me, the key is we've got to move investing in people from supply-driven to demand-driven, meaning we cannot let poor countries sit and say, well, look, if you give me money for girls' education, I'll do it. If you give me money for AIDS, TB, and malaria, we'll do it. But if you don't, we won't. We have to have people saying, oh my God, we've got to go up on the human capital index. Who is the best in the world at this? To which I'll say, Sir Abed and BRAC. Why don't you go and beg them to help you increase your ranking? The other thing we're doing is there are some countries that understand the importance of investment in human beings very well. Rwanda, for example. So President Kagame has been saying he wants to reduce stunting from 38% to 0 in 3 years, right? Now, the thing is, ideology says, oh, no, it takes 20 or 30 years. And it doesn't, right? And I sat with President Kagame, and I said, okay, you really want to do that? We can't do it for under 5 in 3 years, but we can do it for under 2 in 3 years if we turn the 45,000 health worker, community health worker force into a formalized labor, and into a formalized working group, actually pay them for what they do. Because in fact, because technology is going to eliminate so many low-skilled jobs, those are probably going to be the best jobs in the future. So finally, stop playing around and thinking that the poorest should always volunteer. Have you ever noticed that? So many wealthy people get paid for doing nothing, and the poor are always forced to volunteer, right? So turn it into a formal labor force, and if you started with any woman who might become pregnant, identified every single one, the minute they got pregnant, make sure they had the best prenatal care, and then literally do directly observed feeding, directly observed ECD, you could end stunting in under 2s in 3 years. You could do it. Right. So, look, I think it's hard logistically, so we may not get to 0% in 3 years. But we're going to do this so that no head of state or finance minister or health minister can ever say again, oh, it's just too hard. It's just too hard. I remember Carol from Zambia was at a meeting, and I remember when we started HIV treatment in 2003. We started something called the 3x5. Does anybody remember 3x5? Oh, thank you. And it was the same thing. Oh, it's too hard. It's too complicated. And I used to tell a joke. I said, well, when President Kennedy said we're going to go to the moon, do you think NASA said, oh, it's too far, it's too hard, we can't do it? Because when the President of the United States says something, it gets done, right? And I have to say, in this room...
Let's keep going. Keep going.
That so what I wanted to say in this regard was that I think we're saying the same thing on stunting, right? So the students of today, when I tell them that in 2003, every single leading global health expert in the world said you cannot treat HIV in Africa. Every single one of them, except like 5 of us, quite literally, right? Every single one of them. They say, oh God, how can they do that? How could they have been so blind? And they all do that, but then what I say is, look, the point is not to look back at them and say they're blind. The point is to look at today and ask ourselves the question, in 15 years, what will they not be able to believe that we were so blind to? I think stunting is one of them, right? Thank you. But there are more things. But we need to work on this. And I think that my dream is that someday with the IMF and the World Bank both using Human Capital Index and looking at potential economic growth, with investors saying, oh my God, we had no idea that the human capital situation was so bad here, not investing in those countries that do not invest in their people. Ultimately, bond spreads, meaning borrowing costs for the countries going up, we will get the attention of the finance ministers. And moreover, if borrowing costs go up, we'll even get the attention of rich people in developing countries. And my dream is that the rich people will come to the finance minister and say, you know what, you really have to increase taxes, and we're going to pay our taxes now. Right?
And if I can, I want to go to a sort of a next question, but just sort of build on what we, maybe start with you again, because just build on what you just said, and I think you laid it out actually very powerfully already. But one of the things I was thinking about in this session is that in some ways, both of you have done things that the world said were either just too hard or even impossible. And I wanted to tease out a couple of those lessons. So you already, in some ways, just said a lot of that. But anything else you would say, because one of the ways that you have clearly done that is by like sort of showing what's possible and then showing it can go to scale, but also in many ways with 3x5, but also even coming out ahead of the SDGs and setting this goal of ending extreme poverty, and now calling for not just reducing stunting, but ending it. So anything else you would just say about why the importance of setting those very ambitious goals in terms of shifting even just how the world approaches it, and then the accountability frameworks that you've helped build to kind of like keep people on track?
The only thing, I'd love to hear what Sir Abed says about this, but what I would say is that I've played a very different role than Sir Abed. Sir Abed actually has been on the ground, step by step, putting these programs together at huge scale. And my role has been mostly to understand that from what some of the stuff that we did at Partners in Health, but also especially what BRAC did, just become convinced that in fact it is possible. And then my role has been to just sort of get out and very loudly, challenge and set goals and targets. So I've had the much easier role than the people who've actually put the programs together. But I just want to reflect on one thing. So, Sir Abed also said, they said that these people were too poor to pay back their loans. Well, guess what? In 1959, the year I was born in Korea, in Seoul, the World Bank said the same thing about Korea as a country, right? Korea as a country did not qualify for a World Bank loan until 1963, because before that they said low literacy rates, only agriculture, no industry, all the raw materials are in the north. This country is hopeless, right? So I keep reminding people of that, because to me, the act of declaring a group of people, whether it's because of their income level or because of the country they live in, as hopeless is an act of great violence, right? So, you have to start with the assumption that there's no such thing as a hopeless person or a hopeless country. And I can say those things loudly and clearly, not because I've done it, but because people like Sir Abed have done it.
Yeah, thank you.
Thank you.
And so, I think Jim helped set that up really well, Sir Fazle. If you would say, because again, in this sense of like what people said was not possible, I think the work to actually reach the ultra poor, but also frankly just the scale that BRAC has done, in Bangladesh and then in other places, lessons you've learned about both that downreach, but also about going to scale with a kind of like key and comprehensive set of interventions. Even as you said, this sort of scale that you did, you saw the problem of TB, and we'll come back to this, but you went to scale at national level. Lessons you've learned from some of that?
Well, scaling up to me is very important in the sense that otherwise you don't really have an impact. So remaining small and beautiful is not my philosophy. I'm all for big and impactful. So that's what we want in poverty. I mean, we don't want we want everybody to come out of poverty. So it's important to scale up things, but scaling up also. The way I do it, I first do a small program and make it efficient, make it effective, and then I try to make it efficient. The way I try to do it efficient is that cutting down the inessential tasks and focusing on essential tasks, and make it as efficient as possible, and then scale up things regionally or nationally. And then also I have to convince donors. I have to find the money. So you have to show that the result is good in a small scale. And then as it grows, you have to also go on innovating so that it continues to be more and more efficient. So all these, and then you have to also have the capacity within your organization to be able to scale up things. So the first thing to do, of course, is to have a good HR department which can recruit right people, good training department which can train all the people that is needed, good accounting and audit department so that they can keep track of all the money that we are going to spend. So all these things need to be done with a view to scaling up things nationally. And BRAC has done it so over many times in education, in healthcare, in ultra-poor program and so on, that we have continued to do that over and over again. And I remember when we started our primary school system for children, particularly girl children, and we started with 20 schools first. And these 20 schools, we had to make it effective, good quality schools, and we wanted to learn from everybody. So we went to all over the world trying to get the best systems. I mean, wherever they taught good mathematics, and we found that the Dutch do a good mathematics curriculum for their children. So we got some Dutch mathematics teachers to come and work with us. We had New Zealand people train their teachers the best in terms of teaching mother tongue. They're learning mother tongue, reading, writing, and so on. So we got some 2 teachers from New Zealand to try and help us to give their technology to us. So we collected lots of the best systems, teachers and technology and people like that to come and help us to set up these schools for children who are, because of poverty or gender, are unable to access primary education. We wanted to make it also cheap so that it doesn't cost very much. So we developed the curriculum, and then we set up 20 schools and ran these 20 schools for 3 years before we made sure that the children have learned well and they can compete with the other children in the primary schools. Once we have done that, then we were ready to expand our program. And the donors saw the program were effective, and so there was no question of not funding an expansion of that program, which was so effectively teaching children. So over the years, we have been able to provide primary education to about 10 million children. 6 million of these children are girls. We wanted to give education to girls. The girls were going behind. So only in Bangladesh today, there are more girls in primary schools than boys. So it was possible to expand. So like that, we have been able to expand all our programs. We thought that when it is effective and the delivery was perfect, we could do it effectively. My friend Jim Kim always talks about the science of delivery. And I think we have been able to do the delivering quite well. And as a result, we have been able to expand the program.
We talk about it and teach it, and you actually do it, Abed. So,
right. So, but then, my real disappointment is that the Bangladeshi school system didn't learn from BRAC's experience at all, because they think they know better and they don't want to learn from an NGO what it is doing. So what I've done then is to set up an university and an Institute of Education and Development. So that institute, together with the Columbia University, we have set up a curriculum for master's degree in educational leadership and development. And we are now training all the district education officers of Bangladesh to go through this program, so that we are starting at the top, and then hopefully we will then start with the teachers training and so on. So ultimately we will have an impact on the national system, because I don't think private system, I mean BRAC was able to provide primary education to about 10% of the children of Bangladesh. So, but the 90% are still provided education by the government. So the government system has to improve. Otherwise, we are not going to get a high quality children educated in high quality education system. So that's what we are now trying to do. So trying to get the government to provide quality education, or provision of education, quality education from the state, is what we are after.
That's great. That's great. I mean, and again, it's such an example of of seeing a problem, coming up with an intervention or a set of interventions, and then really testing how to go to scale, and then seeing what the next problem is, and creating a new solution. And then again, your commitment to replicating and working with partners to replicate and sort of develop those interventions in their own countries, and sort of adjust them to local need, but still replicating is quite remarkable. If I can maybe segue into a related issue, which is, in some ways to all of us is so obvious, but yet I think it is so central that it's worth talking about, which is just, again, the central role of women and girls and gender in poverty and in ending poverty, and not just elevating access to services, but sort of economic access and legal rights and agency of women. So Fazle, if you would say a bit more just about some of the ways of how and why BRAC has women at the center of its work to end poverty. You've pointed to some of them already in terms of like girls, majority of girls in your schools, but just sort of other areas and the sort of strategies that you've used and what you've seen from that.
Well, I have always felt that in poor countries, the real management of poverty is done by women, in the sense that in the household there is lack of food, lack of all kinds of things, and it's the mother who really has to beg, borrow, steal to put food on the table. So she is the one who actually manages poverty in poor households. So I thought that while they're managing poverty, why can't they manage development? So I started working with the women, and we felt that women's agency as agents of change is very important, and that has, and we have not looked back throughout our work with microfinance, healthcare, education. We have focused on women's agency as agents of change, and I still continue to think that if this should, in many countries, including Africa, we need to focus our attention more on women as agents of change, and particularly poverty alleviation, where women tends to be the main managers of poverty.
Great.
Yeah.
Great. And maybe even just say a bit more about, because you've talked about your education, primary education programs, your some about the ultra poor programs, but I think you also do really other interesting, the whole constellation of health programs as well, but also you do really powerful work around even like legal rights and other pieces. So just anything else you'd want to say about
Right.
the range of work that BRAC does in terms
Oh my
of
God.
supporting women. not all the details, but just to share with people a couple of the other areas, because it really is a constellation of interventions to support women's agency, I think.
Right. No, absolutely. We have 105,000 women, one in each village. We call health promoters. So they are the main workforce on looking after the health in the village. So if you're talking about nutrition, Jim just talked about ending stunting. If we have to do that, then of course we have to look after the mother, children, nutrition, and so on. But BRAC now has in Bangladesh almost in each village one woman and who is also supervised by another person, another woman, who is a health worker. So health worker supervises 105,000 health promoters. Each of these health promoters go to 20 households every morning and asks anybody coughing for more than 3 weeks. Anybody coughing for more than 3 weeks, she collects the sputum and take that to a laboratory to see whether or not is the sputum positive case of tuberculosis. And if she finds one, then of course she will see to it that 6 months of drug taking is done directly in her presence by that person in the village. So DOTS, the directly observed therapy on tuberculosis control, is basically done by this woman. And she also sees to it that she completes the course. We also have a program where tuberculosis patient has to pay a small sum of money, which she gets back after he completes the course. So there is incentive for him to complete, and there is incentive for our health promoter also to see that he completes the course, then she gets a bonus too. So like that, we have got a whole infrastructure of women who provide services in healthcare, in antenatal care. Now that we are committed to get rid of stunting in Bangladesh, I think this will be something that they will have more work on nutrition.
Yeah. This is another quiet but devastating critique of ideology. I mean, this is essentially an active case-finding system, which the high priests of tuberculosis have said for years is not possible, right?
Yeah.
So, but they've just done it, and of course the outcomes are fantastic. We actually wrote a case when I was at Harvard. We wrote a case on this, and we teach it every year to our science of delivery, healthcare delivery science fellows. Right? It's great. Just the great thing is just how quietly and effectively they do it, and they're not arguing with the TB community. They're just doing it, and of course it puts the lie to the ideology. And if you're truly committed to outcomes among the poorest people, then you have to often find yourself going against ideology.
And just a slight side note, but many people in this room have worked very actively, as you noted earlier, I mean, obviously around the Global Fund, but also to support the Global Fund and other global health financing, maternal and child health, but also specifically around tuberculosis, which you don't find that many places where people get really excited about the idea of active case finding, and understanding, as an issue of poverty. And I think that what I wanted to say was just to acknowledge the two of you, because you happen to be on this stage together, that you are both the reason that we are working on tuberculosis and started almost 2 decades ago, because when BRAC said that the biggest reason that your microfinance borrowers could not pay back their loans, and the vast majority did, was tuberculosis, it was hugely persuasive to us as a poverty issue. And what Partners in Health was also showing was possible but wasn't being done for people in low resource settings in terms of getting treatment for TB and the devastating impact that was having. That also had us say, like, this is all doable, but it is not a global priority. So I just, acknowledging the two of you, that the reason that we're working on this is literally the two people that are on stage.
But your advocacy was great.
Yeah.
Your advocacy.
It's all of the piece.
I just the thing is, I've been coming here, I think, every year, and so I just now understanding that what this is sort of poverty, tuberculosis, childhood stunting, nerd prom every year, right? That's what this is. You guys sit around talking about active case finding, and then for me, it's a dream come true. I never got to go to nerd prom when I was growing up.
No, we have been well funded by the Global Fund, and we are continuing to get funded, and hopefully over time, the number of cases in tuberculosis in Bangladesh will go down. The number of cases of multi-drug resistant tuberculosis has already come down substantially.
Yeah.
So hopefully over the next 10, 20 years, we should be able to get rid of tuberculosis
quite
altogether.
amazing.
That'd be great.
As most of the developed countries have now eliminated tuberculosis.
And I actually have to say, I remember just a story to tell. I remember actually taking Senator Durbin, from Illinois to see BRAC programs, including the ultra poor programs and the TB programs, and then we sat with you to have lunch at one of the BRAC centers, and he had just seen these programs. He was incredibly impressed, and asked you, like, what can I do for BRAC? And I felt like it was the most generous. I mean, you were just being honest, but it was the most generous thing, because you didn't ask for anything for BRAC. You just said, you need to fully fund the global fund. And I thought it was the most generous, like, comment for the world as well. I mean, it benefited BRAC, but it benefited the world. And
Right.
I saw
No,
huge
absolutely.
generosity in that one. He probably would have done anything you asked. Jim, just to go back to you, on this issue of women and girls, anything else you would want to say about the bank strategy, how it relates to the sort of the human capital investments, this new women's empowerment fund? This is a priority for the new IDA. I mean, anything. I encourage you to say anything you'd care. And also the healthcare workers, which I think is a really interesting piece about women's empowerment in the labor force.
Well, there's so much that we do, and we have a comprehensive strategy. We're also setting very specific targets for inside the organization. So we do the he for she movement. We set very aggressive targets for the number of women in leadership positions, and it's just something you have to watch internally, externally. There's the evidence is just overwhelming that women's participation in the labor force, doing things like professionalizing childcare. I mean, that's one of the things that we really would like to do, to pay women especially for the care that they always do. That would also allow other women to work, in the formal labor market. All of these things are just very practical goals and targets that we have to set. And I think you're seeing more of it. I mean, Japan, a very conservative culture, they're now professionalizing childcare, and specific because they know that the Japanese women's participation in the labor force will have a huge impact on their GDP per capita. Now, I think it's generally happening, but I'm very excited about this women's entrepreneurship initiative that we started, because it's for the first time it's going to be both providing cash directly to women entrepreneurs, linking them to a virtual mentoring network. We're trying to create a virtual ecosystem for entrepreneurs. But for the first time, it's linked to a public sector fund in which we're going to work with governments to remove obstacles for women to get access to capital, to own businesses, and all of the steps that we've been following for years help them to get rid of those policies that are preventing women from going forward. And then, this is now going to be leveraged into a multi-billion-dollar fund. It's the first time we've done it. Now, there is a political overlay to all this, as I'm sure many of you have heard. But realistically, we work with every single one of our shareholders, and this is an idea that I think will really take off and could have a very powerful impact. And the insights that come from what BRAC has been doing over the years are ones that, of course, will be part of the network, and we hope that BRAC will support the mentoring process of women all over the world.
That's great. That's great. And then I think, go ahead.
No, go ahead.
No, I was just going to say, and I think there's a powerful, substantive as well as sort of strategic linkage of the ultra poor programs to this piece as well, because in some ways it's almost getting women who can even get onto the ladder,
right.
And then how do you move them up the ladder?
Right.
And I think that is the. So maybe I know.
Let me just say one of the things. One of the things that I just really admire BRAC so much for is that I think for a long time we've thought of microfinance as like the solution to all problems, and it's a solution to a huge set of problems. It's critically important. It's had a huge impact.
Yeah, of course.
But what we've seen is that people who are receiving microfinance have a very difficult time then taking the next step into formality, the next step into building a small and medium enterprise. So I think the entrepreneurship facility is that next step. That especially women need to be able to have financing for the next step. We're even finding that there's been funds that give women capital for startup, but then there's no fund to give capital for scale up. So we'll do that as well with this entrepreneurship facility.
Right,
Yep.
right.
So maybe just one more question before I think you need to leave, and then really hurry to the plane, and then we'll continue. And then we'll continue some further dialogue.
Oh my
Right.
goodness.
Is because you're talking to a room of advocates, and it's come up quite a bit. But just any comments you would want to make about the importance of advocacy, and maybe particularly looking forward, like how can we continue the work that we do in our donor capitals, but also kind of work with all of you to create a pull factor at country level. What are some of your thoughts about the next important places we all need to be working as advocates?
So we're going to need some ground cover, as it were, for this Human Capital Index. It's going to be incredibly controversial. And the countries, for example, there are some very large countries that will find themselves ranked below Bangladesh. And countries that have much higher GDP per capita than Bangladesh, that will be ranked lower than Bangladesh. And I'm telling you, they're not going to like it. And so I hope, I hope that we can work together on building the advocacy around this, because this is not about shaming. It's not about accusing. It's about advocating for the people who have not been as effective because of their poverty and advocating for themselves. This is directly aligned with the needs and interests of the poorest people, right? So we need your help on that. But on a larger scale, I think one of the things that I've noticed over the years is that even a small number of phone calls, especially from you guys, makes things happen. I mean, it's amazing what 25 or 30 well-informed phone calls can do to change the mindset of very powerful people. So advocacy is really critically important. And also, when you come here, I know you're hearing from political leaders, but you're also learning about some of the details, like active case finding. How many people here know what active case finding is? A lot of people, right? Not your usual Washington audience. When I can't stress enough the importance of you guys staying together as this network. There's something really pure about results, because it's not about branding the institution itself. It's not about sort of saying that you all have the answer, but you guys have been about what we call, and in a film you'll see tonight, is that right?
Bending the Arc, yeah.
We worked long and hard to try to find what is the right sort of theme for us, for Partners in Health, in going forward. And we chose something called a preferential option for the poor. And you'll hear us talk about that in the film tonight. And a preferential option for the poor comes from Catholic social teaching, the liberation theologians who were persecuted in the 60s and 70s and 80s in the Catholic Church. But the way they talked about it was, it's not, when you make a preferential option for the poor, you're not saying that everyone else is bad. You're just saying, you love everyone, but your preference is for the poor. And if you do that, then where do you end up? What is your responsibility? So what I tell people is the hardest thing about embracing a preferential option for the poor is understanding what it is not. Right? A preferential option for the poor is not a preferential option for your own program. It's not a preferential option for your ideology. It's not a preferential option for your union. And it's not, the hardest one of all, it's not a preferential option for your poor, the poor that you're working with. There's the reason Sir Abed is so incredible, because he could have stopped with a few villages and done a great program, the pilot phase, and just been so proud of his efforts. But then he would have known that that's about him and not about the problem, right? And the problem is still 700 million people living in extreme poverty, another 3 or 4 billion that don't have sanitation, access to so many things. That is the problem. And if you want to solve the problem, you can't be focused on making a preferential option for your own stuff. You have to keep saying, but there's still this problem out there, right? I think you guys do that better than any group I have ever seen. You're so enthusiastic, but the pride is in making a difference for other programs, other people in other places. That is just so valuable. So continue. As long as I'm around, I'll come back as often as you invite me. Right? But let me end by saying this, right? So I'm really worried right now, right? And if some of you, I just did a TED Talk, and the way I talk about it is, I was born in a country that was said to be hopeless, and now I'm president of the World Bank Group, right? But what I see everywhere is that aspirations are rising, right? That anywhere where children can have access to a smartphone, they're going to see how everyone else in the world lives. And it's perfectly reasonable, and I think something we should embrace, that everyone's aspirations in the world are rising. And I talk about a convergence of aspirations. Aspirations are getting the same. And so we have now, we're racing against time. 25% of all children in the world are stunted, 150 million children. That's the nexus of people who are going to be very disappointed once they find that they cannot compete in the digital economy of the future. So the sense of urgency that I have today is greater than it ever was, because it used to be, in 1990, I was still doing this work in 1990. In 1990, almost 40% of the world was living in extreme poverty, and there was not the sense that everyone knew how everyone else lived and aspirations were going up. That's where we are now. That's exactly how it should be, but unless we get better at thinking about the foundations of human solidarity. Tom Friedman has said, and many people have said this, but the science of technological progress is going like this, and the art of human solidarity is going like this, right? So we have to find a way forward. We have to find a way forward that also protects the planet. Solidarity means that we're in solidarity with fellow human beings, our progeny and grandchildren and great-grandchildren who'll be living 100 years from now. What does that mean? Right? I think it means that if we've learned that the project of the equality of outcomes is difficult, and that's what we've learned. I mean, equalizing outcomes, we tried that, and it's been very difficult to do that. We have to commit, just as you guys have committed. We have to commit and recommit and double down on our commitment to equality of opportunity. And that at its foundation is what you guys are fighting for. So thank you for what you do. More than anything, I come here every year to thank you for what you do. It makes a huge difference. Keep at it, and also have fun at the Nerd Prom tonight and later. Thank you.
Yeah, thanks.
Thank you. Thank you. All the best. Thank you.